Good afternoon, everyone. Hello. How do you do this afternoon? Thank you so much. I hope lunchtime has not taken its toll yet. So we'll still be energized by the morning spree. My name is Mike Fafudi. One of the people who will be governing the process this afternoon as scheduled per our agenda. And I hope every one of you has a program before them so that we don't lose your concentration for effective listening and participation. Without wasting any time, let me take this opportunity to welcome you all in your diversity to this important session in which we will review our contributions, look at our weaknesses, generate more strengths, and soldier ahead with more and new enthusiasm. Thank you very much for honoring this gathering this afternoon. We look forward to concentration, attentiveness, and the positive contribution. Hope everyone here has a program. Amongst us, we also have distinguished guests who will constitute the unfolding of our agenda this afternoon to deliver more insightful engagement, to engage us more and mobilize more to sharpen our focus, and so that collectively we can remain engaged with the battlefront to create a better working space in the mining environment that is able to engage and defeat diseases and other occupational hazards. Let me welcome you all in your variety of specialties and professions and representations to this gathering. On behalf of the Council, as an active participant, and without wasting any time, you would be aware that amongst us, we have esteemed guests that shall deliver inputs to guide the conversations towards a common outcome. We will have Dr. Tutula, we'll have Eva Kiwango, we'll also have Simpue Mabele, and obviously familiar face, Tsepo Sidibe, who will coordinate a panel discussions. Later in the session, we'll be seized with the input from Notando Moyo, and towards the end, we'll round up the session and highlight the key achievements of the day, which we shall use to forge a new path ahead. Without any waste of time, let me start by saying that as we gather here, not so long ago, a total lunar eclipse took place on Sunday on the 7th, September 2025. Does not sound strange, eh? Myself and other South Africans saw a stunning red moon in our skies. We are told by those who know better that this happens when the Earth is placed exactly between the moon and the sun. We meet here well placed in the south of the African continent, endowed with well sought after assortment of minerals. Around them lacks the liability of diseases in our varying occupations. I guess this red moon development, in as much as it has a coincidental proximity to this meeting, because of its connection to the universe where we exist, it certainly carries an array of meaning to us gathered here because of its reflective regalia on the assorted cultural landscapes. Some believe in transformation and renewal when they interpret the gaze of the red moon. Therefore, believe it is a symbol of change and renewal. It encourages individuals to let go of outdated habits and have new opportunities which provoke individual transformation and growth. Amongst them, believe that it represents emotional wakefulness. Therefore, the red moon increases compassionate alertness. It is my submission that this is what we seek to embed in our collaboration against diseases through Masoyise program. Some still deem it to mean connection to nature. Therefore, drives our individuality with acknowledgement of our success in our interconnectedness. This is what we have profiled as partnership in this interconnectedness. It is generally acceptable that the red moon forecasts diversity of our cultural plurality. Strikingly, we are universally combined in the understanding that it summons interconnectedness that triggers collective growth and maximizes prospects of success and opportunities. Indeed, at this point of our assembly, we are summoned by the same drive of interconnectedness in the mining industry to strengthen an optimistic multi-sector partnership by all in conscious efforts towards achieving an optimal state of well-being of human beings fixed in the functions of the mining industry for subsistence. Tied together consciously through rational choices and guided by the multi-sector collaborative approach, it is possible to optimize our well-being at both the shop floor and the workspace for the benefit of the homestead and the community. For diseases have shared boundaries. In the partnership of Masoyise, we recognize this diversity, but with willingness to collectively share both risks and creativity using combined resources to optimize the state of our wellness. Masoyise vision from its information in 2018 continues to galvanize all for a successful existence. And this was what is besieging the moment as we trade through the program this afternoon with all our alertness. In this regard, a great round of applause to accept everybody now present. That's an important moment to introduce myself. Thank you so much for Fudi, who's part of the stakeholders today, this afternoon, and will be presiding momentarily over our progress as we soldier on until at least 30 minutes after 3 o'clock. With that being said, I'd like to call upon one of the key drivers and an esteemed active participant in this drive, a familiar face, whom all you know, a passionate activist in her own right within this diverse minefield of seeking to better the working conditions of all in the mining industry. You are together with me when I introduce Dr. Balfour, who is a qualified, just to reinstate the facts you obviously know, who is a qualified medical doctor and a public health medicine specialist, supported by an MBA background to that effect and a diploma in occupational health. She has a wealth of management experience that spans more than 30 years, 19 of which have been at strategic level in the mining industry. Her key strengths lie in strategic leadership. No wonder she is part of these proceedings and analysis, advocacy, and lobbying to make progress of this adventurous collective initiative. Dr. Balfour also has a certificate in board leadership from the Gordon Institute of Business Science, a member of the Institute of Directors of South Africa. She has served on several boards, for which I will not mention. She currently serves on the Department of Minerals and Energy, Mine Health and Safety Committee. She also equally serves on the PUSA task team on the National Health Insurance, currently serving on the South African Health Ministerial Advisory Committee on COVID-19, and had the honor to be named as one of the top 100 global inspirational women and human being in the mining industry in 2018. A round of applause. I will obviously call her on stage to deliver the marching orders. Thank you very much.
Thank you very much, Program Director, for that beautiful introduction. Of course, it does reveal one's age, when you go through it. Good afternoon to our distinguished guests, ladies and gentlemen. Do we have people online? Okay, and those online. It is my honor, privilege, and a pleasure to welcome you to our Masoyise Health Programme parallel session hosted here within the National AIDS Conference. We are excited to be getting back into the rhythm of our AIDS conferences, TB and AIDS conferences, which alternate. Those of us who have been around, we know that this time, June was time for Durban, and we always looked forward to it. We are here, we accept it, we are here, but definitely the breeze in Durban, it added something additional to the AIDS conferences. This parallel session provides a timely opportunity for us to reflect on the achievements of Masoyise Health Programme and to bolster its strategic direction going forward. It also emphasizes the importance of cross-sector partnerships in driving sustainable health outcomes in the workplace. And this you'll see through our panel where we have put together, people from across various sectors. The theme for our session is strengthening wellness, workplace wellness partnerships and synergies with the Masoyise Health Programme. And this theme underscores our commitment to deepening collaboration across sectors by promoting integrated HIV and AIDS response strategies and wellness in general, tailored to the unique needs of diverse industries and communities. So it is my task to actually welcome you, and I have a special word of welcome and appreciation to Ms. Eva Kiwango. I'm getting my vowels wrong, Kiwango, who is the UN AIDS Country Director in South Africa. We look forward, ma'am, to your wise words and how we can strengthen partnerships for HIV and wellness in general. I recognize the diverse panel we have today, notably representatives from trucking wellness and the manufacturing sector. Together with representatives from the Department of Mineral and Petroleum Resources, the mining houses, TEBA, and organized labor, this panel promises to provide us with a wide range of insights into our theme. I also particularly welcome any delegates from the conference who have prioritized this session, and I can assure you that we are not going to disappoint you. I would also like to recognize because it's a tripartite from the mining industry. Everyone from Mine Health and Safety Council, the CEO of the Mine Health and Safety Council is here, as well as colleagues from the council and everyone else who is associated with the Mine Health and Safety Council. Last but not least, I warmly welcome the Masoyise Health Programme family. Anyone who is in that family, I won't go through. You know, there's so many stakeholders in that banner. Though that is all of us, the family of Masoyise. You are quite welcome. I also had a special word of welcome for the program director, who I have found is an astronomer and a philosopher. But actually, because he is from Organized Labor, National Union of Mine Workers, I had especially said he needs to feel free today to say, Amandla, Pambili Masoyise, Pambili. So you are free, program director. And thank you thus far, you are doing a sterling job. A very brief note about Masoyise Health Programme. This program was conceptualized around 2015 and was implemented in 2016. So we're talking about 10 years since its inception, and you will see from our booklets, we are now in the 4th phase in terms of the strategy for Masoyise. And I hope you will read further in that. So Masoyise, in its years of existence, has played a pivotal role in advancing workplace wellness across South Africa. By fostering targeted responses to HIV and AIDS within the workplace, the program has contributed meaningfully to both public health and economic resilience. I will not give you the statistics, but we have done very well, and I hope during the session that the progress that we have made will come through. In a country where HIV remains a significant public health challenge, workplace-based interventions are not only vital for protecting employee health, but also for sustaining productivity and livelihoods. And this is particularly important in this era of the US withdrawal of funding for TB and HIV programs. There is thus an even bigger expectation that workplace programs should come through in ensuring that at least the people that are employed, which is about 8 million in South Africa, do have reasonable access to healthcare or to especially screening for TB and HIV. Masoyise's collaborative multi-sectoral approach, bringing together government, the private sector, organized labor, civil society, and the UN organizations, has demonstrated that workplaces are powerful platforms for reaching adults with prevention, testing, and treatment services. These efforts have become a cornerstone of South Africa's border HIV response. Today marks a significant milestone because we are also going to have the official launch of the Masoyise 2025 to 2030 strategy. This strategy represents our collective vision for the next phase of workplace wellness in South Africa. In summary, our approach today is simple yet powerful. It is share, learn, apply, assist. We will therefore share experiences and lessons from Masoyise and other sectors. We will learn from one another's successes and challenges. We will apply these insights and strengthen our future efforts. And we will assist other sectors where support is needed and possible. In conclusion, ladies and gentlemen, once again, we are honored to have you all here today. Your insights and contributions will be very invaluable, and would really like you to participate and provide those insights, as these will make this session far more fruitful. Thank you very much.
Thank you very much, Dr. Tutula. As we proceed smoothly with our program, let me take this opportunity to welcome in the case the star of the moment, by definition and program. Dr. Kiwango. I hope she's around and feeling very comfortable as we soldier on through the conversation to create better working conditions. Dr. Ivai Kiwango, if you are around, please take a seat. Okay. Thank you very much. South Africa is too populous. I can't know everybody by face. Thanks, Dr. Tsepo. For a brief background, probably most of you know her in action and words because she's coming out as a distinguished activist in this arena. She is a representative of UNAIDS for South Africa since 2021. Over 30 years of experience in international relations and development imperatives. She served in the UN for 24 years in both global, regional, and country postings in Switzerland, Ethiopia, Mozambique, and obviously South Africa. Prior to her appointment, she equally served as the UNAIDS representative in our neighborhood, Mozambique, for almost 5 years. She coordinates the UN scale-up relevant data to guide national strategies and programs for intervention, including scaling up community-led responses and the mobilization of resources. Before joining the UN, Eva worked in Tanzania on rural community development with an organization acronymed DANIDA and USAID, and as a consultant with the Tanzanian Ministry of
So yesterday you heard my boss at the opening of this conference make reference to the UN Secretary General Antonio Guterres, who reminded us that ending AIDS as a public health threat by 2030 is within reach if we dismantle barriers to services, protect the rights of everyone, everywhere, and we stand in solidarity with communities. And that is the spirit of this year's South Africa AIDS Conference. That's in line with the theme of this year's AIDS Conference: Unite for Change, Empower Communities, and Redefine Priorities. Some of you may have participated in our launch of our UNAIDS report in July. We launched it in South Africa together with the Minister of Health, and my executive director came here. Our report entitled AIDS Crisis and the Power to Transform. And it tells us two truths: that a crisis persists, and so does our power to transform it. So a crisis exists, and we have the power to transform it. And South Africa stands at the center of both these realities. We carry the highest TB and HIV burden globally, with 8 million people living with HIV, and I'm sure you've heard all of these statistics. Yet South Africa is also leading with courage and innovation. More than 6.8 million people on treatment. The Better Man for Tomorrow campaign, which is challenging harmful masculinities, that was launched last year. The Bold Close the 1.1 Million campaign, that was launched in February this year by the Minister of Health. And the End TB campaign, which was launched during the commemoration of World TB Day, with a target of testing 5 million people during this 2025-2026 period. Our report, which we launched in July, shows that we're making remarkable achievements. And since 2010, we have reduced by 40% AIDS deaths. We have reduced new infections by 40%. We have reduced AIDS deaths globally by 54%. These are remarkable contributions. We have protected 4.4 million children globally from acquiring HIV since 2020. Our report details the most successful public health response in history, saving 26.9 million lives globally. And this is possible when the world comes together in solidarity. But huge gaps remain. The report talks about the gaps that remain, and we know globally 1.3 million new infections happened last year. 170,000 new infections in South Africa alone. And Dr. Balfour referred to the funding crisis within which we are now. We're seeing massive interruptions in international financing. Last year already, even before the US government froze its funding, financing for HIV had already fallen 6% from its peak. And then we had the January event, where we saw the largest donor globally, representing 73% of international resources for HIV, freezing its funding. This, of course, we have to state it clearly, created a systemic shock to the HIV response globally, triggering disruptions to treatment and prevention programs around the world, but especially in high burden, low and middle income countries of Africa. We saw medicine stockouts. We saw disruptions that are leading to increases in new infections. And the modelers were warning us of what will happen in terms of new infections increasing and AIDS deaths rising if we do not address this crisis. And we all know that this will not only lead to an AIDS crisis, it would be a crisis for the broader health system. Because caring for the sick and the dying would place a huge burden, again, on our weak and fragile health systems, and this is already happening. So this is where I skip. Let me keep skipping. So, crisis. It's happening. We all know that it's happening. But I must say that global South governments are rising to the challenge. And South Africa is one of them. I keep skipping. And yesterday you heard during the Deputy President's remarks at the opening how South Africa is stepping up. You all know about the allocation that the National Treasury has made, that South Africa continues to fund a lot of its domestic, to put a lot of its domestic financing towards the response in this country. And the private sector also continues to play an important role. And we require your sustained leadership and action. And at this moment of massive disruption in the response, I want to recognize the resilience, the resolve, and the courage of dedicated representatives of business, employers, and organized labor, and how you are supporting governments and communities, especially through the private sector forum of the South African National AIDS Council. In South Africa, the private sector has already made many important contributions to TB and HIV. The Masoyise Health Programme of the South African Minerals Council is a key example of transformative leadership that has revolutionized health outcomes in the mining sector. So let me praise this program for a minute or two. Firstly, let me commend the program's inclusive multi-sectoral approach, which brings together government departments and agencies, employers, and organized labor. It is well known that the success of any workplace program requires a tripartite approach. This collaborative effort, which ILO refers to as social dialogue, is a key strength of the Masoyise program. Secondly, the Masoyise program remains an exemplary model of aligning with global frameworks like the SDGs, the Global AIDS Strategy, WHO End TB Strategy, and pertinent ILO recommendations, which are numerous. Thirdly, it adopts an integrated wellness approach that it incorporates TB and HIV, which is where we started, and it's added on non-communicable diseases, including diabetes, hypertension, occupational lung diseases, and a gender-responsive approach. Now, the inclusion of mental health key targets in 2023 represented a groundbreaking shift, the inclusion of mental health. And this is in line with our national strategic plan for HIV, TB, and STIs. And in reading this booklet, I see now that it's including women's health and cancers. I just read that just now. So integration, wellness approach, multi-sectoral, not HIV and TB in isolation, which we all know can be stigmatizing, right? Perfect. Lastly, the Masoyise targets employees and groups that are identified at high risk in mining communities. So your services can reach those who need them most, including young women, sex workers, the elderly, LGBTQI, men who have sex with men. So what sets Masoyise apart is its multi-sectorial approach, multi-stakeholder approach, its rigorous performance, its monitoring, and the promotion of best practices across member companies. Now, the new Masoyise Health Programme strategy for the period 2025 to 2030, which will be launched today, is a significant milestone for addressing and ending HIV and TB in the mining sector. The strategy is aligned with global, regional, and national frameworks to ensure that the Masoyise program remains on track in terms of its targets. And as the UN, we are very honored to be involved in this program. And right now, ILO, WHO, and UNAIDS are involved, 3 agencies. But as the UN in South Africa, there's many more of us. So the first pledge we're making today is that we're going to bring more agencies to the table to work with the Masoyise program. I was having a tete-a-tete with Simpiwe from ILO, and we've committed that we will bring UN women. After all, you've got women in here. We need to bring other agencies like the World Bank involved in TB and the issue of silicosis. We know that they're involved in that. So bring the World Bank to the table. And many other partners. We'll see who else we can bring to the table. So that's our first commitment. That is my first commitment for today. Led by ILO, so we as the UN joint program in South Africa, we have a division of labor. So we don't crowd you out as we sit around the table, because like I said, there's 3 of us now and we're bringing many more. So we have a division of labor, and ILO is our convener when it comes to the Masoyise program. But all of us are engaged in the steering committee, the working committee, and in organizing activities and sharing information. And right now, as I said, we have a funding crisis, so we need to do more around resource mobilization. So that's my second commitment for today, that we work together to mobilize resources to support the work of Masoyise. And we can do that. And there are different avenues for doing that. And if we go to funders together, we're more likely to get resources than if we go alone. And as you all know by now, because I saw it in here, is that the Masoyise program does not only contribute to SDG, the Sustainable Development Goal 3, which is around health, but you also contribute to SDG 5 around gender equality and SDG 8 on decent work and economic growth. And I think you contribute to several other SDGs. I think we need to do an analysis and add them in here, because I'm sure you're contributing to education, the SDG on education. So as I've said, through our technical support and through our partnership, we'll bring more agencies on board, and we will find a way to make sure that we coordinate and mobilize resources. The work that this program is doing is diverse, it's integrated, and it addresses a lot of the issues that are of concern to us. So friends and colleagues, to end AIDS by 2030 and build workplaces, healthier workplaces and strong communities, we cannot ignore what's happening globally, right? These geopolitical shifts that are happening, the wars, the widening inequalities, the climate shocks, and funding disruptions that I've mentioned. So I would like to recommend that we work together with this Masoyise program on 2 things over the short term and long term. We need to ensure that the work of ending AIDS is fully resourced, okay? We need to continue to urge donors to sustain and increase aid. And I've said that we will work with you on that. We need to make sure that government in South Africa is sustaining and expanding its domestic financing. Like I said, South Africa finances the HIV response to a great extent. South Africa is going through a lot right now. We all know about the tariffs and everything else that's happening. but we cannot take our foot off the pedal. We need to make sure that we bring the private sector forum on board to fund communities and frontline workers who have been impacted by these funding cuts. And we need to secure the Global Fund's 8th replenishment. It's happening in South Africa. And the aim is to raise $18 billion over the 2026-2028 period. And this year's replenishment is being hosted by South Africa and the UK. And we want to make sure it's a success. So we call on the private sector, we call on mining companies to be part of the replenishment and make sure it's a success. The second thing I want to urge us to all get involved in, and you heard this yesterday, when the head of the United Nations said, prevention is the new cure. We cannot treat our way out of this pandemic. Prevention is the new cure, and it's prevention of TB, prevention of HIV, prevention of cancers, prevention of diabetes, prevention, prevention, prevention. But where HIV is concerned, I want us to all roll up our sleeves and really help the government of South Africa, which we congratulate for being one of the first countries to roll out lenacapavir. I'm sure you're all hearing about lenacapavir everywhere you go in this conference. We need to roll out lenacapavir. We don't have a vaccine, but this is the closest thing to a vaccine. 2 injections per year prevents you from acquiring HIV. 2 injections, painful injections in the stomach, but 2 injections. 2 injections. Now, this is crucially important for these populations that are at high risk, especially adolescent girls and young women. It's a game changer for them. I can't even explain this. Expands their choice. It strengthens their advocacy and their agency where they cannot negotiate condom use. They have injected. Doesn't matter if you want to use a condom or not. We do need to use condoms to prevent other STIs, but at least they won't acquire HIV. Now we need to work together to help to support South Africa to roll out this drug. We have funding from Global Fund for the next 2 years, but we need to advocate for the price of this long-acting injection to go down. We all need to advocate. Your employers will also be taking Len. Modeling shows us that if the company that produces lenacapavir can produce this drug for $100 per year. Right now in the US, it's costing $40,000 per year. We can't afford that. Low and middle income countries can't. So we all need to work together to make sure the transformative potential of lenacapavir is taken to scale in this country. So in closing, we have the tools, we have the knowledge, we have incredible programs like the Masoyise Health Programme. All we need now is continued political will, sustained investment, and purposeful partnerships. We know that this HIV and TB response, they were forged in crisis. You remember back in the day when treatment was too expensive and we were toying on the streets. So our responses are forged in crisis, but it's built to be resilient. And the world is looking increasingly at the private sector to play a larger role in advancing equality, equity, dignity, and shared responsibility. The Masoyise program has had a profound and transformative impact. I was reading the data in here. Very impressive, some of the data. Why are there no indicators for lung, no targets for? They're there? Okay, so we'll keep track of that because I saw a bit of a gap there. We'll keep track of that. Let's keep continuing walking the path of solidarity to maintain progress and scale up the response in workplace health challenges. Together we can transform crisis into power. Together we can end AIDS by 2030. Siyabonga, thank you so much.
Thank you so much, Madam, with an insightful contribution. Mr. Simpue Mabele, please warm up as Dr. Tsepo keeps fit. Clearly, from the submission now made, you can only conclude the familiar words that familiarity breeds contempt. That's why now the funding crisis for these, against all these novel interventions. The input emphasizes the fact that we should soldier on modeling a multi-sector sustainable approach consistent with global frameworks in the battle against occupational diseases. Definitely, a partnership in the mobilization of resources is important instruments to push back against the tide of ailment. Most importantly, an ounce of prevention is better than a pound of cure. Thank you very much. We'll move on without wasting time to the next speaker, quite conversant in the battlefield against all manner of diseases, particularly in the mining industry. Of the same breath with the previous two speakers, I speak of Simpue Mabele, who is a known management and development specialist, an ILO technical specialist on health and wellness programs globally, spanning an experience of 30 years in both education and training and development. She carries an extensive academic experience in education, psychology, labor law, public health, and management of development. His work experience has focused on workplace health and wellness, including addressing GBVH matters related to rights at work, gender equality, diversity, inclusion, HIV, and TB. Joined the ILO in 2007 and currently providing technical support and guidance across 18 countries in both East and Southern Africa. Obviously, also a familiar face. Please welcome him to the podium with a round of applause.
Thank you, Program Director. Good afternoon, everyone. I am going to stand on all the protocols that the Program Director and the keynote speaker have established. But I have two disclaimers to make. The first one is, indeed, I'm from the ILO. However, I am standing before you representing the SANEC Private Sector Forum. I was deployed by the ILO to the SANEC Private Sector Forum in 2021. I am part of the leadership, and therefore I have been requested by Ms. Mpumi Zikalala, who is the chair, to speak on behalf of the forum. And on that note, I do acknowledge the chair of the Civil Society Forum of SANEC, Babisoli Ndugu. I'm just breaking protocol there just to make sure that you acknowledge Mpumi was here. The second disclaimer, I'm going to adopt Eva's strategy in terms of skip, so that I can take less than 10 minutes. because I actually am in trouble because over the years I have now, there's a tendency of going off script. So I'm always under adult supervision. So they actually prepared a few slides. So I'll apply the skip approach so that the next presenter, program director, can be able to have enough time. So the SANEC Private Sector Forum, as you may be aware, is one of the three arms or legs, depending which one you choose. There is government, there is a private sector led by the Private Sector Forum, and then there is civil society. And it was in 2021 when the former deputy president and the late David Mabuza launched this forum, acknowledging that the private sector has a role to play in the HIV response. I am really hoping that the technology will allow me to skip, and it's not moving. So the mandate of the Private Sector Forum, if you look at it, when it was established in 2021, it was really to foster a coordinated response in terms of the impact of HIV, TB, and STIs, and also to coordinate and communicate the voice of the private sector response to end gender-based violence and femicide. And lastly, also to coordinate efforts around COVID-19. I'm going to request the technicians to work with me here because this is failing me. So if you look at the vision and the mission, really the PSF is the voice of the South African private sector, and ranging from different levels, be it apex organizations like Business Unity South Africa, Business Leadership South Africa, or the associations that are affiliated to these. This includes your Minerals Council South Africa, Banking Association South Africa, and many more. And the mission is really to rally all the private sector players in South Africa, whether big or small, to unite and coordinate the meaningful contributions. Around 2021, there was a pledge that the Private Sector Forum presented to the leadership of the country, both government and civil society. And amongst other pledges, the Private Sector Forum agreed that they will actually decentralize the work of the Private Sector Forum, including launching what is called provincial private sector forums to ensure that the private sector is engaged not only at a national level, but also at provincial level. To date, the private sector has actually facilitated launch of the provincial private sector forums in 8 provinces, as you can see. The KwaZulu-Natal is the remaining one, so those who are from KZN should be looking forward to mid or late September to launch the forum. Otherwise, all the other 8 provinces, they actually have launched the provincial forums. Given the theme of the conference, it is important to focus on partnerships. And the question the Private Sector Forum is asking themselves is that why partnerships are crucial. It's because for effective response, we must bring together these partnerships. And I quote once again Ms. Eva Kiwango in terms of how this program is designed to ensure that government, employers, and workers are involved. So partnerships remain relevant because they ensure an integrated approach. Partnerships is about expertise sharing. The private sector has a vast expertise and experiences, and those are quite important. So the various players that are there, they have been counted. I'm not going to go through the list again, but I do want to acknowledge civil society organizations as one of the key partners and international organizations as well. So currently, the focus of the Private Sector Forum is very strategic in the sense that there's work that is focusing on advocacy, whereby the private sector is coordinating together with the council, the SANEC Trust, and other, including government and civil society as well, but also very much strategically placed in terms of the resource mobilization efforts to work within the global fund mechanism where the private sector is represented through the PSF in the CCM of the country. And there are some other management related activities that we provide. But I do want to highlight, and this is one of several, where we have various partners coming together. For an example, the likes of Seriti Resources, the likes of Afrocentric, the likes of Exaro, and other players in the private sector who have contributed. And I just want to make an example. In Mpumalanga, they were able to put together their resources to reach about 17,000 people. And if you look at that, the reach in Mpumalanga, there would be both males and females. And in one province, yes, there were more females than males. And then Limpopo as well, where we reached 8,000, more than 8,000 women and men. But the private sector, together with the players that are there and other stakeholders, has managed to put together almost 60 million in cash. And this has managed to facilitate reach to 460,000 people in 8 provinces. Perhaps you will ask me which province in Mpiwe is not counted there, because we have 9. So it is Northern Cape, but that is a story for another day. So finally, moving forward, and Eva, I'm looking at your direction this time around in terms of what is then the private sector committing moving forward. The strategic partnerships that the PSF has forged are leading towards these areas where there are commitments that are related to technology and data in terms of enhancement, in terms of research. There's a role that the private sector would be playing there. And then logistics and supply chain. We were talking about the issue of drugs. So there is expertise in the private sector in that regard. So it is going to be important to ensure that we bring those expertise. So the list goes on, which would include finance and professional services, specialized services or programs. So Program Director, I'm going to end here as the private sector. And I do want to take off my hat as PSF member and back to my ILO hat. I just finished a book, Program Director, and I'm not selling the book, and I'm not selling on the behalf of the author, but the book is called Employee Wellbeing, Contemporary Workplace Challenges and Evidence-Based Interventions. It's by Pooja Vishwanathan. Those of us who have an interest, it was actually published last year, and I think it would benefit all of us in the room. Thank you, Program Director.
Yeah, thank you very much. Without any waste of time, and in respect of time management to allow proper conversation by the next block of esteemed individuals, I hope that this skip tendency does not cause us to skip treatment. So we must keep the skip tune circumspect. Thank you very much. Dr. Tsepo, it's now your game and your turn to take over the beautiful audience and attendees to the minefield of conversation that will be illuminating and educative. And let me take this opportunity to welcome you and the panel. To make you active, perhaps it's better to call upon you to introduce your panel, to integrate you into the process. You would know also that these are also familiar faces in the trajectory. Thank you very much.
Good afternoon, colleagues, and allow me to as well stand on the protocol that a reliable deployee of the private sector, Simpiwe, has stood on. I'll stood on the same protocol, but equally, Babu Selinduku and Madam Eva, allow me to acknowledge you. And I'm not going to skip, I'm going to rather say in compliance, in trying to be compliant with time and time limitations so that we can comply to medication and not skip medication. So I'll try to be rather quick. Allow me then, colleagues, to usher in the second part of our program. We're going to have a panel. The aim and the objective of this is really how do we learn from others? We absolutely do not subscribe to brilliance reside only at the top, but also brilliance resides on the ground. There's a lot that we can learn from colleagues who are on a day-to-day basis engaging with these challenges and learning and coming up with wonderful solutions. So we are aiming to spread the family. In the next HIV/AIDS conference, we want to make sure that this particular banner doesn't fit in the room because we've grown the family. Now we've got 3 more spaces that we need to create. UN Women, we need to create the World Bank, and so forth and so on. So in that spirit, from the Masoyise Health, we have extended an invite to colleagues from other sectors because we think it's really valuable to partner. We think it's very, very valuable to learn from one another and make sure that we drive a better agenda, a bigger agenda in terms of improving workplace health. So allow me to call my panels to the front so that I can introduce them and we get into the conversation. May I request the mics, the microphones, please? That's it. I was in one of the satellite sessions, and I've learned something quite valuable. When program directors introduce people, we tend to take quite a lot of time. But when folks introduce themselves, they tend to be brief and to the point. So it's not disrespect. I'm going to request that you introduce yourself, colleagues, and then we'll follow up with the conversation and questions. Go for it.
Good afternoon, everybody. Thank you very much for this opportunity. It's absolutely wonderful to be with like-minded people and to be inspired again. My name is Judith Bester, and I'm today representing a program called Trucking Wellness. It is also a partnership of labor, government, employers in the transport and logistics industry.
Thank you.
Good afternoon. I'm Dipalisa Mukoboto. I'm apparently wearing 2 hats. I hope it won't be too heavy for me. The Mine Health and Safety, I'm representing Mine Health and Safety Council and the DMPR. I'm the Principal Medical Inspector and been working with Masoyise on TB and HIV. Thank you.
Thank you.
Afternoon, everybody. It is such a privilege to be here and to be in a room with like-minded people. So thank you so much for extending the invitation. I'm Vanda Wellifier. I'm an employee wellness specialist in the manufacturing sector. I have the wonderful opportunity to work with a very forward-thinking plant director of Nissan South Africa with a very esteemed and highly motivated senior management.
Awesome. Thank you.
Good afternoon, ladies and gentlemen. Andrew Ellis-Cole from Sibanye Stillwater. We've been on a long journey with a number of the stakeholders here, and I recognize a lot of people. So very pleased to be here. Thank you.
Thank you. Dr. Andy. Is that mic working? Yeah, go for it.
Good afternoon, ladies and gentlemen. I'm Busisiwe Baloyi. I work for TEBA. We work with a lot of mining houses doing post-employment health, and I'm responsible for managing the social services at TEBA throughout the region. Thank you.
Thank you very much.
Viva Masoyise Health Programme, viva.
Viva.
Manda. My name is Victor Khadebe. I am from organized labor. I am working in the sector, mining sector, so I'm gonna be here as representing the mining sector. Thank you.
Thank you very much. And proof to testimony, had I introduced them individual, I'll probably be still at the second one. So colleagues, once again, allow me, typically you would have a panel, a facilitator laying down the preamble. Can we agree in principle that the speakers before me laid down a solid foundation and a preamble? There's no need for me to repeat the wonderful things that they said, the gaps, the challenges, the importance of coming together, and what we seek to achieve as a collective. Can we agree in principle that I excuse myself from the preamble? Thank you very much. Now, it's a wonderful, diverse group of stakeholders, ranging from partnerships in the world of work to understanding our responsibility being beyond the world of work, that the life of a miner goes beyond the fence, isn't it? So it's important that when we have this conversation, we also capture that aspect as well, to make sure that when we say you're fit for work, you're fit for life, it includes as well work or life beyond our fences and into the post-employment space. So colleagues, allow me then to start first with understanding some of the wonderful work that you've been doing. Most of you are managing programs. Most of you are in a space where you input into creating wonderful strategies that are seeking to shape the response in some shape or form. So maybe if I can start, Dr. Cole, Andy Cole, if you allow me, just share with us briefly as to, in your current role, what has been the most impactful intervention for your sector that you have implemented for the workplace wellness? And maybe you can as well touch on how have partnerships have helped and contributed positively to these achievements?
Yeah, thanks. As I said, it's been a long journey, and we still need to find ourselves all the way to 2030. But I think significantly, some of the stuff that we have done was the implementation of tier.net at all our operations. Thank you. So basically that enabled us to manage our patients quite rigorously, and we're able to follow up our patients' TB very objectively. So that has helped us with our viral load suppression rate, and some of our ops are achieving the 95%, but also managing our TB program. But I think it would be a miss if I had to dwell on the past, and I'll come to the partnership. Sorry, if we look to the future, Sibanye, and it's great to work for a company that's so enlightened, to be honest, and to be able to map the strategy and to align to programs such as the SDGs and to Masoyise. But for the future, we've got community programs that are planned in conjunction with the Sibanye Rustenburg Mine Community Trust. We are in the we have started a program in our peri-mining communities to door to door. We're targeting 30,000 households, and we'll be offering HCT and TB screening there, but also linking those to care. Just on the partnerships, so many partnerships. I need to thank the DOH for their unwavered support. I think they spent 4 months with us training our people, implementing systems. Guys from the ILO, WHO, thanks for the guidance and the support from the top. I mean, we take direction from that. So, yeah, without the partners and the movement, the Minerals Council, Tutula, you and your team, I think we work very well together. So I think there are many more to thank. But without them, I think we push each other to achieve more. So thank you very much.
Fantastic. Thank you. Busi, if I can come to you. I mean, all of this work we talk about, quite often, you know, our efforts will be reflected on how people are well post-employment, you know. So what has been your experience in terms of how were some of the innovative interventions and partnerships have contributed positively to the world post-employment, you know, health post-employment?
So for us as TEBA, given our history of recruiting mine workers from all over, one of the strengths is that we have offices across SADC. And what has worked for us is that we are able to go to where the ex-mine workers are. So we are able to provide those community-based services at their home provinces or home countries, and we are able to follow them through the continuum of care. So where a mine worker is medically boarded due to an injury or an occupational disease, then we are able to link them to care when they arrive at their home country or home province. And we are able to follow them up through our home-based care services, which are also, you know, expanded to reach the families of ex-mine workers through education and providing the families with the skills to take care of their sick or injured family members coming back from the mine.
Thank you very much, Busi. I mean, you might argue that we are joined at the hip with the trucking industry, because some of the stuff that we dig from the ground, we put in trucks, we move it to all parts of the world, isn't it? So from a trucking wellness perspective, share with us, what are some of the impactful wellness initiatives that we've put in place so that we can really respond to the clarion call of how do we respond to aid the National Strategic Plan of 2025 or 2023 to 2028?
Thank you. Yes, indeed. I always think the trucking industry is like the blood vessels, taking everything from A to B. And obviously we have a very challenging environment as our target audience is on the move. So they're not in their hometown, they're not everywhere. So I think the success of trucking wellness was really the accessibility, taking the service to the truck driver. And in the area, then the community as well as the sex workers. So we have 20 roadside wellness centers, with a professional nurse, and we provide holistic, integrated adult primary care. So it's also not only HIV where we started, but it's now an integrated primary care service. And it's on the national route, and it's in a truck stop. And it's open at night. So the truck driver is en route, and he stops, and he fills up, and he has a bath, and he takes a nap, and then he can also access the services at the wellness center. And they don't pay for it. It's already paid for by the National Bargaining Council and the road freight logistics industry. So the private sector is funding that services. And even though the community members or the guy working at the truck stop, everybody can come. Further then, there's mobile service centers, and they go out to the depots where the logistics industry, at the warehouses, because those people work shifts as well. Dis-Chem warehouse doesn't only open from 8 to 5, it's open 24 hours. So our mobile services go to the depots and again bring it to people. We then also partnered through the previous SAPCOA, the predecessor of the private forum, partnered with Daimler Truck Southern Africa, who manufactures Mercedes-Benz trucks. And we started a structured workplace wellness program that we take to some of their key customers, which are small and medium-sized enterprises. Companies like not a DP World or Imperial, as you might know, it's smaller companies that are not legalized because they're not transporting dangerous goods. They don't know how to deal with health in the workplace necessarily. So the Daimler Truck funds that program, and we go to the customer, and through a 2-year period, we help them to implement a formal, structured workplace wellness program.
That's fantastic. Thank you very much. Now, manufacturing probably shares similar headaches and challenges like mining in terms of significant numbers in terms of volume, and as well challenges in terms of we are host to some of the vulnerable members of society. How have you gone about implementing impactful programs that impacted wellness in a positive way in manufacturing?
Thank you. Indeed, I think the manufacturing sector has been under severe pressure with job cuts and unsure working situations. So therefore, we realized that we cannot think of wellness and wellness concerns in silos, but that we adopted a holistic multi-support platform for our employees as well as the employer to engage and support employees. So I think we all recognize that EIPs and EWPs are critical, but underutilization is usually one of the biggest stumbling blocks with them, as well as employees seeing EIPs and EWPs as punitive matters implemented through HR. And then mostly it only focuses on reactive support, whereas with the adoption of a preventative, proactive, holistic, multi-platform support system, we move away from reactive interventions rather to preventative. And educating and exposing employees as well as the employer to health and mental health information in order to empower them to take more responsibility for their own health, but then also becoming a more productive and engaged employee in the workplace. And then I think the biggest leg of our initiative is utilizing community resources and partnering with community resources in terms of linking and referring and making sure that employees get the help that they need, but then also benefit to the employer for having healthy, productive, and encouraged employees they feel cared for.
Awesome. We cannot have thriving workplaces without thriving communities, isn't it? Thank you. Leadership, okay, representing the entire organized labor and not NUMSA. Hey. That shows you how united we are. I mean, in the tripartite space, you know. So we come from a very, very challenging past where we used to be proud of colors to the current where we can have, you know, various stakeholders agreeing in principle that organized labor will be represented by one person. Welcome. Share with us leadership. And I mean, part what we have seen over the years is how organized labor has really come to the fore in terms of how they can support driving well-being, driving a healthy worker. What have been your experiences in the world of organized labor?
Thank you, Program Director. As organized labor, we are having also a responsibility when it comes to issues of HIV/AIDS and other programs beyond it. It can be TB, it can be anything. Now, in the mining sector, there is a tripartite forum that deals with all the issues that have got to do with, you can name them, conditions of employment, you can name them in terms of all these things that are dealing with. It can be diseases, it can be other programs that have got to do with health of an employee in the workplace. Now, we have been involved in the tripartite structures where we managed to develop, for instance, an integrated policy around HIV and TB as a collective in the mining sector. Two, if I have to be specific, I will talk about the issues of HTC, where it's a voluntary program, and we have a policy of 95, 95, 95 there. And that has also been agreed upon as a collective within the tripartitism. The other part, we're also having, this emanates from some of the milestones that we do have in the mining sector that we normally meet and sometimes evaluate and check out the progress around those aspects. But coming to the trade union as now individual, part of the responsibility that we do have is to also conduct trainings around our members, especially when it's got to do with issues of training, development of members, giving them information around any other thing that affects them. We also, some of these programs are talking about, they also done at, we do have mines, we do have medical centers where they also look at screening of employees and do this voluntary check, what you call testing and so forth. So this is part of our participation as organized labor within that, within the mining sector. We have refused to actually allow a process where there will be issues that are going to be discussed about us without us. Manta.
Awesome. I think you can get that sense of ownership, accountability, and through that, then we can sustain these programs, isn't it? Thank you. So, quite often the relationship between employers and the regulators are adversarial. Hey, and we have moved far beyond that as a sector, which is something quite pleasing. We have Dr. Dipalesa representing the regulator. Dr. Dipalesa, in your experience, how have you seen the maturing and progression of these programs in the world of work? Are we improving? Are we seeing better coordination, partnerships, and is it delivering the results that we really have committed to?
Okay, thank you, Tshepo. As I indicated before, I will be wearing two hats. So let me start with the one hat from the DMPR side. I must point out firstly the impact, the most powerful impact that has happened, or intervention that has been done from the DMPR side that led to what we are here doing here. I'll tell you why. We started with, at some stage, the prevalence of HIV was not known in the industry, although they were doing a lot of work there. So from the regulator as the leader in the industry, we decided to have a study commissioned by the NIOH together with the World Bank that I've heard should be brought back. I must say they played a vital role at that time. So we had a study to have that was commissioned. And after that study, I must say it set out a cascade of interventions which have led to a whole lot of improvements in the mining sector. One of them being that then we had to establish a committee called MITHEC, which stands for the Mining Industry TB and HIV Committee, which is housed under the Mine Health and Safety Council. So under MITHEC, we then had to have a reporting template for us to get the data that was necessary for the industry, so that we know where the industry is at, to know what interventions, further interventions are needed. And that, I must say that those two, the study, the report, and what the other one would be the milestones. From the Mine Health and Safety Councils, they have led with partnering with organizations like Masoyise and the Department of Health, as well as SANAC, ILO, and the WHO. We have been able to gather information to be able to, to lead in that sector. So we have milestone targets that we need to meet. And so far, I must say, I'm proudly say that we have been able to have a TB incidence rate that has gone down to below that of the national TB incidence. So that's how, because we were known as the mining industry who have a very high TB incident rate, I must say for now we have gone much lower than the national rate. So those are the achievements done in partnership with all our stakeholders. And I must say as well, the TB tool, reporting tool, was the one that Masoyise took over when they started in 2015. So that had already been established at MITHEC level, and it was used widely and seen as a very important tool that could be used to give us information in that manner. So because TB and HIV are public health issues, we of course had to collaborate, and that is why we continue collaborating, continue partnering with all the relevant stakeholders that are required. And I must say, based on that and with the data that we receive at the DMPR, because then the mines started reporting in 2014, they have continued to report, and they are now reporting also to Masoyise. They've continued to report, and we can be able to analyze the data, and it gives us information that we need, information that can be used for research. And because of that, we have been able to see a progress in the way TB and HIV are managed in the industry. And I must say they have improved quite a lot. I think you've heard that there has been a reduction in TB overall in South Africa. There has also been, it means an impact on the reduction of TB and HIV in the mining sector, although we still need to have some work on the gold sector. But overall, the performance has been very encouraging, and I must say the partnership has worked wonders in achieving our goals, or we are getting there. Thank you.
Okay. That is great. Most of you would recall there was a statement that we used to shudder to hear every time we came into this conferences, where the minister would say, if TB is a snake, the head of that snake is in the mines. But I've noted that the tone has changed. They say it's in the country. Hey? But I then quickly remember that, oh, but we are the country, isn't it? We are the country. So, ladies and gentlemen, I absolutely do not hold the monopoly on questions. I think it's only fair, in trying to manage time, to open the questions to the floors. 2-3 questions max, so that we make sure that we do not leave anyone behind who might be sitting there with a burning question. Quick ones, to the point. There's one there.
Thank you so much for the opportunity, and thank you for the presentation. My first question will go to, I didn't catch the names, you'll apologize for that, but say, the activities that you mentioned, some of them will contribute directly to my performance in Bujanala district. Now, I really want to make clarity, understand that some of the activities you said you are going to do door-to-door, HTS services now, HTCS services now. My concern for those that are found positive during door-to-door, what is going to happen to those patients? How are they going to be linked to care? Because we don't want to miss them. It will contribute to my second 95. And the second question, you'll be doing door-to-door, doing TB screening. And those that are expective of TB, how are we going to collect sputum? Or are you going to collect sputum from those patients, from those lines during door-to-door TB screening? There's the two questions for you. And the other question is for you, ma'am, about the trucks. The first question is only one question. In these mobile services, the wellness that we are providing to the truck drivers, do you have the statistic, or because we are interested in knowing the TB and HIV incidence in those clinics? Thank you.
Great stuff. I think the question was directed to Dr. Ellis Cole. That said, I see a couple of colleagues Dr. Andy was talking to, we are going to. There are those of you who already have. So please do share as well how you've managed that space better. Second and last question.
Thank you very much. Mine is with Teba. How is Teba going to assist us in ensuring that the employees that have left are ticked out of treatment or are located where they are? Because, and maybe a regulator must also put an emphasis on how all the mining houses will ensure that they use the services of Teba in ensuring, because the 1.1 million that we are running short of probably should be related to the cross-border employees. Thank you.
Thank you. Last question.
Comrade Gaz.
Amandla.
I know that you, Dr. Tsepo, wofuna ngibe la kule panel uzongama question that are very difficult. Unfortunately, strategically we have sent Comrade Vita to represent us. Look, man, it's not much of the question. I think one of the issues that I think I need to comment on is that the issue around the collaboration within the stakeholders, it does not end on a Mining Health and Safety Council only. It is cascaded down to various province regions where we have the regional tripartite forums. We've got steering committees where we, as labor, we're part of it in order to ensure that the program of HIV and TB continues. And particularly on, let me just say it, particularly at Mpumalanga. I'm sitting on a CSF from Mpumalanga AIDS Council. I'm sitting there representing COSATU. Furthermore, we've got almost on a quarterly basis, we've got health dialogue where all of us we engage. I think one of the issues that we need to emphasize that maybe we should put more efforts, especially on a community base, so that we can able to roll out our program. Thank you very much.
Thank you. Thank you. Thank you. If we can maybe give the panel an opportunity to answer. Allow me to start, Dr. Andy Ellis-Cole.
Yeah. Thanks very much for the question, ma'am. Just to reiterate, this doesn't happen in a vacuum, and therefore we consult with a number of stakeholders. So the program is still new, but the how it's going to be done is there will be GPS locations for anybody that is identified, and those will be linked to care. We've gone quite a long way in resourcing the primary health cares in the region and peri-mining communities. So that is the intent, is GPS location, link people that are suspects to those clinics. Thank you.
Thank you.
Okay.
Shaki?
So we see about, in our wellness centers, 35,000 people a year. And we have less than 1% who have a yes on any of the TB screenings. So we have a very low incident rate there, but we do believe it's because they're on the road, it's only 1 or 2 people in the truck, and the windows are open, and they just the working conditions are different. So that's what we see. In terms of the HIV testing rate, we're sitting at 96.3% of people knowing their status. We then see when last that they tested. So very, very cool. And our infection rate at the moment is only 1.7%. So it's also very, very low. I think our focus was in late 2000s, in terms of 2008, we really focused on STI treatment because that is still our biggest problem. And saying that it's 1.7, I do think we're going to see an increase in the next year or two. If you see me, ask me again, because we're definitely seeing an increase in STIs. So it definitely is going to impact on that. We also see in terms of the funding that's changed. The sex workers around the truck stops had a lot of peer educator programs through USAID funding, and that has stopped, so we don't have any support for the sex workers around our truck stops. So I think we are going to see that ripple effect also in a certain period of time. I think what I wanted to say also is that 1.1 million, we do know that in terms of the men, that's where the issue is. So there's still, if there's anybody from the Department of Health, we really, some of our provinces, we have very good relationships with the Department of Health, and some we really struggle, or district level. And because they're now starting a men's health rollout to kind of like catch the men, but not only focusing on HIV, again, focusing on more integrated health. You focus on sexual and reproductive health for men as well. It's not only a woman thing, it's a man's thing as well. So I do think if we have better partnerships with the Department of Health and we do health for men, that we could really make a difference on the 1.1 million gap. And then we will protect the young girls, because if we can catch the men. I heard the other day, I was in a webinar, part of the Department of Health, and they were saying the majority of women being infected is when they are breastfeeding. So the government is doing so much work in terms of prevention, vertical transmission, but then they get infected during breastfeeding. And I was thinking, okay, but I need to find the men who's infecting them. And so we really want to work on that. So Department of Health, we're ready for you.
Thank you. Let's get the last answer. But what I'm hearing coming from colleagues from government is that the need for us to strengthen our partnerships, the need for us to share the data, and we can do better. Thanks. I'm in trouble. Colleague from the Health Directorate.
Yeah, Johannesburg.
Yes.
Yeah. I'm quite impressed with your truck drivers program, and I was also impressed that they are actually being taught in a sort of orientation about HIV. So I hope that you are also having an access to PrEP, so that it can, you don't just test to actually try find positive, but to prevent also. So the sex worker program is quite difficult to manage because they are highly mobile, and they are not really in one place. They are moving with the trucks. So I hope that with regard to Johannesburg, you can find us so that we can assist you, because we have key population, and consider also opening up to LGBTQI in the truck space.
Good. Colleagues, I see there are many hands coming up. Allow me, because we need to wrap up, allow me to say this. Because there's been a question for Teba, we have a very healthy post-employment steering committee in the Minerals Council. We can share information and data for you far more than what Teba is providing. Reach us after this conversation, then we'll share with you as to how we're managing issues outside of the post-employment space. Thank you. If we can just give a round of applause to our wonderful panel. Thank you.
Thank you, everyone. Okay. Order, please.
We're not done, colleague.
Please, let's give a moment to Dr. Notando Moyo to deliberate on the launch of Masoyise. Quite an experienced activist in health and wellness, and let's give a loud of applause. Thank you.
Thank you. Thank you so much, Program Director. Good afternoon, colleagues, distinguished guests. All protocols observed because of time. So we're actually trying to launch our program, our strategy, Masoyise Health Programme. So we're going to cue our video. Lights off, please.
Greetings. I am Mike Deke, the chairperson of Masoyise Health Programme, a Minerals Council-led multi-stakeholder initiative. Today, I want to talk to you about something we must all take seriously. In South Africa, cancer is a major health challenge for men, especially prostate, lung, and colorectal or bowel cancer. Knowing the signs and risks of these cancers can help to catch them early, which leads to better treatment results. Prostate cancer is the most common cancer in South African men, and the risk increases for men over the age of 50 or those with a family history of the disease. The symptoms can include difficulty urinating, blood in urine, lower back pain, or pelvic discomfort. But the key to survival is early detection. Men over 50 and black men over 45 years should get regular checkups and blood tests for prostate cancer. If you have a family history, you are encouraged to start even earlier. Another cancer we must be aware of is bowel cancer. It's one of the leading causes of cancer deaths in South Africa, and the risk increases with a diet high in red meat, smoking, lack of exercise, and being overweight. Look out for symptoms like abdominal pain, blood in your stool, changes in your bowel habits, and unexpected weight loss. Prevention is simple. Eat more fruit, vegetables, and fibers. Stay active and don't smoke. Screening for colon cancer should start at age 50. Lung cancer is another significant cancer often caused by smoking or exposure to harmful chemicals. Symptoms can include a persistent cough, chest pain, shortness of breath, or coughing up blood. If you smoke, I urge you to quit now. There's no better time to start taking control of your health. I know it's easy to push our health aside when we're focused on work, but taking care of ourselves is just as important. Regular health checkups and screenings can save lives. Early detection is key, and there's always hope with the right treatment. You don't have to go through it alone. But physical health is only one part of the picture. Mental health is just as important. Many of us face stress, worry, and other challenges that can weigh us down. Talking to someone, whether a friend, family member, or counselor, can make a world of difference. If you are feeling overwhelmed, remember that there's support available. Reaching out for help is a sign of strength. Brothers, let's take charge of our health, our bodies and our minds. Regular checkups, a balanced lifestyle, and support for each other can help us live healthier, longer lives. If you have any question or need help, reach out to your workplace or local clinic. Visit your local cancer care center for information on and bookings for blood test screenings. Your health matters. Check it. Protect it.
Thank you. That's Mike Deke, our resident, our CEO, who was the former chairperson of Masoyise. We now move on to the next placards, just to showcase. The first ones are showcasing our objectives, as you can see. And they're all in our little booklet here. Take it home, read it so you know what we're doing at Masoyise. And the next ones are showing our targets. Because there's no way of winning if we're aiming at nothing. We must aim at something to catch something. So our targets are linked to the SDG goals, as we did say, ending HIV as a threat, reducing pneumoconiosis, ensuring that we're actually looking at cancers and lung cancers. Okay. So as they're busy showing them, go ahead. Thank you. So these are showing us where we're actually targeting to reduce all of these threats to the mine worker. So Masoyise actually strives to take every man and woman home healthy. Thank you, ladies and gentlemen. A big clap. We have officially launched the Masoyise Health Programme. Thank you. You can walk through. You can come through.
Thank you. Like Simpiwe earlier said, and I noticed that maybe if we can close that door so that we can wrap up quickly within time. And if we can settle down, colleagues. Thank you. Thank you very much, Dr. Notando, for highlighting the new Masoyise strategy. And I think we can all agree that these are ambitious targets, but these are achievable targets. And the only way that we can achieve those particular targets is through partnerships. I've been requested to summarize. Those at the back, don't be like me when I was still in primary school. Back. Okay, so yeah, remember in primary school, my teacher used to say, grade 7 teacher, summarize before I summarize your ears. And my ears, there's not much space to hide them. So I'm gonna try and summarize as best as possible. Madam Eva, in an African culture, we tend to reciprocate. Shikamo. I'm too young to say jumbo. So shikamo, and I hope I'm pronouncing it correctly. I think you have highlighted the importance of we have to pivot. It can no longer be business as usual. That option is no longer available to us. There's a clarion call that has been made in terms of how do we rethink our response. But this response would be ineffective if we do not leverage partnerships and if we do not challenge our response to the core, not limited to the various programs that we run, but how do we then deal with advocacy? How do we then deal with resource mobilization? And how do we make sure that we grow this family and to make sure that we bring innovation into the space? We bring those who can help us in making sure that we go beyond just our workplaces, but we impact the communities positively. And in that, this would be something sustainable. So I think the message is very clear. And the challenge that you put in before us in terms of what we have to do as a collective is how do we then make sure that we continue to partner with those who are mobilizing funds to close this gap, but as well, how do we then not become just a funder? How do we roll our sleeves and actively participate in improving the situation within our communities? I think that message has landed very well. I like the part where you're talking about it's important that we guard jealously this inclusivity nature and the approach, and how do we make sure that we continue to align ourselves to the global strategies, regional strategies, continue to contribute into the national development agenda because we exist within communities. For workplaces to thrive, we have to have healthier communities. And it's important that we continue to fight the battle of integration and make sure that integration becomes key and core in what we do. And yes, very, very, very grateful of the pledge. We've documented it. We will share with the principals. We are looking forward to other agencies joining us. We're looking forward to UN Women. We're looking forward to World Bank coming in, joining us. We are looking forward to more and more of the UN family joining this wonderful movement. And it's important that we highlight that if we work together to mobilize resources, we can achieve more. If we go alone, if I go alone, if UN go alone, we're not going to achieve much. So I think it should be the spirit in which we approach the next replenishment, the 8th replenishment, which South Africa and UK are responsible for. So this type of tripartite spirit or the collective partnership spirit would be something that would augur well for us in making sure that we are successful in terms of the tripartite, or rather the 8th replenishment. Dr. Tutula, I think you highlighted the importance of making sure that we continue to grow this beyond just this sector that is mining. And I think testimony to that is extending an invite to other colleagues in the manufacturing sector, colleagues in the trucking sector, because we know how important it is for us to make sure that we continue to collaborate, we continue to partner, and we continue to make sure that if we are keen to go the distance, we need to take others with us. And the distance is 2030 and beyond. So we can't get to 2030 and beyond. I can get there quicker, but if I leave others behind, then it really doesn't benefit anyone at all. And as well, it's important that we really make sure that we continue to use programs like Masoyise to champion the concept of access. If you listen to a number of speakers from the panel, they spoke about the importance of access. They spoke about the importance of making sure that we create programs that people will be able to access without stigma, without any challenges. And for us as a collective is to look at how do we then leverage Masoyise to champion the concept of access. And I think the panel was quite clear in terms of their various strategies that they're implementing. And all of them spoke about one important principle as well, which is partnership. You know, how do we leverage partnerships across sectors, across stakeholders? How do we partner with the likes of government? I think the very questions that we had, they yearn for partnership with government, partner with us at the district level, partner with us in terms of what we do. If we're going to find men, let's find them together. If we're going to find people who are, having TB and are not on care, let's find them together. So it's important that we continue to appeal to how do we then strengthen this partnership beyond just our fences, beyond just our sector, and partner with others. And I think the Masoyise strategy, in terms of the new strategy, continues to highlight how this particular sector that is mining understands and holds dear the concept of achieving SDG 3. I think initially we were preoccupied with making sure that we achieve it within our sector, but now there are wonderful examples, and I think Dr. Andy's call together with the Spanish group have highlighted now we are going into communities. This work to communities, we reduce the burden for government, and we partner with government as best as possible to make sure that we impact those peri-mining communities that are next to our operations. So if Siriti, Exaro can do it, imagine if the entire sector is doing that, then we'll be able to leverage quite a lot in terms of making sure that we have a sector that is contributing positively and meaningfully to the development agenda. Colleagues, I really don't want to take further of your time, and I was requested as well to do the closing, so consider this the closing session, but I would like to first acknowledge there are men and women who worked tirelessly to put together this particular satellite session. It would be amiss of me not to acknowledge them. And I say they did it in a partnership spirit as well. So all the sectors were represented. So I acknowledge you, those who put together this. We were honored, Madam Eva. We were honored, Babunduku, in your presence. We were honored, the CEO of Mine Health and Safety Council was here. The leadership of organized labor is here. Different parties are here in terms of organized labor. We are really honored from the colleagues from other sectors like manufacturing and trucking. Thank you for honoring us, and thank you for being here and sharing. And thank you, Dipalesa, representing and wearing multiple hats. For those of you who not ever had Dipalesa as two, she can always give you one. So thank you very much for honoring us from the regulator's perspective. Thank you, ladies and gentlemen.